Protests by workers at Chris Hani Baragwanath Hospital have once again highlighted the challenges facing Gauteng Hospitals. The health department says contract workers were hired on a grant budget and they can't all be accommodated in the new financial year.
Now, this is despite the staff shortages and budget constraints in the province's health sector. eNCA's Heidi Giokos takes a closer look.
There have always been concerns that Gauteng hospitals aren't coping, especially since Charlotte Maxeke is still not operating at full capacity. A recent protest by workers at Chris Hani Baragwanath, one of the country's biggest hospitals, has exposed some of these inefficiencies and challenges.
We currently are going through a very difficult time in the hospital, and I think there are a number of reasons. Many of them are well known currently. But I think the big challenge we're facing is that we have a historical shortage of a budget to allocate to staffing. And while we've made motivations and we've made representation for many, many years, asking for the hospital's budget for staffing to be addressed, our staff establishment to be adequately provided so that the needs of the hospital can be met.
In a briefing on Friday, the province's health department CFO denied there's a financial crisis, but she said some workers hired to help during the COVID-19 pandemic will have to be laid off. While hospitals understand the special budget allocation for more staff has lapsed, they're pleading with the department to understand the tremendous workload hospitals are facing.
The staff establishment at Bara is not aligned to the workload at Bara, especially now that we are also carrying the burden of the closure of Charlotte Maxeke together with our sister hospital, Helen Joseph Hospital. So the volume of patients that normally come to Bara is huge. It is huge. I mean, if you can go to our clinics, on average, our pharmacy, the head count in pharmacies is around 1,200 per day. And we admit, maybe depending on the season, it can be up to 10,000 patients per month that we admit. If we check at our delivery rates, it's high. We are the biggest hospital in the country and in the Southern Hemisphere. So we just don't have enough hands, to man the workload that we have to carry.
The challenges are not just staff, but also infrastructure problems.
The current challenges we face because of the fire at Charlotte Maxeke Academic Hospital have aggravated it, particularly in the surgical environment, because there are only two major trauma centres in this region of Gauteng. One was at Charlotte and one was at Bara. And now that without the one at Charlotte, the one at Bara is facing extreme challenges. The volume of work, the severity of the injuries that we're seeing make it really difficult for us to manage, not just from a staffing point of view, from a range of different infrastructure.
The Gauteng health sector is hoping their levels of desperation will motivate the department to address these issues with the urgency they require. Heidi Giokos, Johannesburg.